should be good. All right, Tom, it feels like I haven't seen you in like a million years in person.
It's been probably over a month.
That's kind of crazy. So we wanted to do a bit of an update on coronavirus and how things have really kind of impacted our practice and
Yes.
impacted the areas that we are in, and also how our clinic's going, what we're seeing, and just kind of get something out there for, our patients who check us out on Facebook and our referring
Yes.
doctors and things like that. So for a man who needs no introduction, I'm talking here with Dr. Tom Stone. He is primarily in our Louisville office. I'm John Kitchens. I'm in our Lexington office, and we're with Retina Associates of Kentucky. Tom, give us a rundown on the status of coronavirus in Louisville, Lexington, and throughout our region here.
Yeah, well, it's hit us, as it has the rest of the country. I feel like if you look at the numbers, not as bad in Kentucky as some other places, largely because of how aggressively I think we've been social distancing through the recommendations of the governor. But we're over 1,400 cases at this point, and just like in many other states, it's hitting hardest in the urban areas. So Jefferson County, where Louisville is hit, more than any other county, and Fayette County has got quite a few cases. But looking at the projections that are being constantly revised with new data, it looks like, here we are on April 10th, and it looks like the peak is guessed to be at about April 21st. So we're not at the peak, but we're getting closer. And so hopefully this will be through us, sooner rather than later.
And how are things from a hospital standpoint there in Louisville in particular? You hear words or you hear messages that there are a lot of doctors affected at certain health systems, that hospitals may be near capacity. What are you kind of there?
Well, they've built up excess capacity to be on the safe side. And what they've also done is taken patients who don't have COVID-19 and as safely as they can, get them to rehab facilities or go home and leave the hospital. So some of the hospitals are actually, don't have a lot of people in them right now in anticipation of the COVID crisis. Most of the healthcare workers do remain healthy, but there are lots of patients and lots of ICU beds currently, even at this stage of the pandemic. So right now, we are not overwhelmed, but we are prepared. And again, looking at the projections that come out, we should have enough beds. It's just making sure we have the beds in the locations that they're needed. And I think the state has been very good, and the medical authorities have done a good job with that here.
That's a really, really good thing. I agree with you. I think that the governor has been really out front of this, and we've made changes early and often to be able to ensure the safety of all of our citizens of the Commonwealth. Likewise, in Lexington, I can tell you that the parking lots for the hospital that we're next to, St. Joseph's East, is virtually empty. And so that tells me that the hospital is really, has locked things down from an elective standpoint. And they're screening people as they come into the hospital. They're not allowing visitors into the hospital. You have to get your temperature taken. You have to wear a mask when you're in the hospital. So I feel like we are being appropriately aggressive with things, and similarly in some of our satellite offices that are affiliated with hospitals. So it's a very safe environment. It feels like a very safe environment to actually go to the hospital right now.
Yes, ironically, I would have to agree.
So talk to me a little bit now about our practice and the types of patients that we're seeing. What's the status volume-wise of the practices? What are we doing, and what are you doing particularly in Louisville?
Well, practice-wide, we're trying to be as responsible as we can, and that's changed over time. I mean, early on, and we continue to be very aggressive about, finding out if people have any symptoms. We ask all the questions that have, it was originally, have you been to China? And then it was Italy. And, really now there's a lot of hot spots throughout the country. We've also tried to keep up to date on some of the symptoms that might be early symptoms of coronavirus, things like upset stomach, sore throat, loss of smell. And we ask all these questions as well. So I feel like once we get through these questions, which we do over the phone before people even come in, and we repeat when they come in, that we're screening out any significant source of illness in folks. But some of the other things that we've done is, all patients are now wearing masks. If they don't have one when they come in, we give them one, but we're encouraging people to wear or bring their own mask when they come in. And certainly all our staff is wearing masks and wearing the appropriate protective equipment to keep everybody safe.
Are you
Our staff has really stepped up their game, and I mean, we have a fabulous staff to begin with, but they've really responded passionately and professionally to this, and they're doing a wonderful job to help keep our patients safe.
I agree completely. Are you doing anything to limit the number of patients that are in a waiting room where there could be that 6-foot encroachment?
Yes, we're doing that actually quite a bit. As you know, John, we all have in our practice essential patients, urgent patients, who, if they don't get treatment, they will lose vision and can go blind. It's primarily with the injections that we do, but also with some of the surgical cases that we see and do. So we've basically limited our practice to those patients at this time. That means we're seeing only about 40 to 50% of our normal volume. And that means we space out the clinic appointments. That means that patients come alone to their appointment, even though most of our patients have a driver. We ask that driver to sit in the car. And so we're only bringing in those patients who need to be seen. And so really our waiting room is almost empty most of the time, because we see the patient and we see them sometimes even in a more abbreviated fashion. So we just get the essentials of what we need, and then we take care of their needs, and then they go home, and we try to schedule only when absolutely necessary.
What are the things that you would consider to be essential things? Let's say that I'm a patient, or I'm a referring doctor, and I'm getting calls, or I have a problem. What would be the things that we should call the office and say I need to be seen, both for a novel patient that has not been seen before and a patient that is a routine patient of yours?
Well, I think there's multiple conditions, but the big ones we're starting to see is macular degeneration, where someone either has been getting injections for macular degeneration that have had to be delayed because of this, who are starting to lose vision, or maybe somebody with dry macular degeneration who's become wet. We're also seeing some what we call peripheral retinal problems, like retinal tears, retinal detachments. So, if there's a new patient or an existing patient who has floaters and flashes, we don't know if that's a PVD, which is, doesn't require treatment, or it's a horseshoe tear, or even a retinal detachment. And I've seen all three of those come in as floaters and flashes for new patients, even in the last week, and I'm sure you have as well.
Absolutely. Talk a little bit, Tom, about the operating room, and where are you operating at? Where is Retina Associates of Kentucky operating at? There's been some word about ASCs being shut down, or surgery centers being shut down for
Yes.
possible need for ventilators and things like that. Where are we at as far as getting cases done that need to go emergently?
Yeah, this landscape has changed radically over the past month or so. We mainly operate at surgery centers, outpatient surgery centers in Lexington and Louisville. In Ashland, we operate in a hospital primarily. We also operate in a surgery center in Danville. And so most of these surgery centers have either closed their doors completely, rather, or they maybe open 1 or 2 days a week. So our emergencies sometimes can't wait that long. So in Lexington, fortunately, St. Joseph East has remained open for emergency cases, and we've been able to do them there. Here in Louisville, the main hospital is taking care of corona patients, so there's no longer opportunity to provide surgery at Norton Hospital. So we were able to arrange with Physicians Medical Center Regional Hospital in Southern Indiana. So I'm starting to do my emergency cases there, and we're able to take care of folks with these urgent and emergent problems, so they don't lose vision while we're waiting for OR access.
And I can say from a Lexington standpoint, I had concerns that hospitals would be overwhelmed and that
Hmm.
patients would be sick, coughing, and sitting in hallways and things like that. And honestly, that couldn't be further from the truth. At least at St. Joseph's East, you walk in there and the place is a ghost town, which is actually a good thing if you're a patient that needs to have surgery. You don't want a overburdened hospital that's full of sick people with coronavirus for fears of you getting it. And I'll be honest, I feel completely comfortable operating. And I was worried that
Yeah.
we'd be in the midst of a pandemic and shut down virtually from being able to do our cases. And it's absolutely the opposite. So I feel like patients can feel incredibly comfortable if they need an emergent surgery like a retinal detachment repair. So, Tom, let's talk just a little bit about where you see this going and going forward and what you would anticipate and how Retina Associates of Kentucky is going to react.
Well, that's a very good question, and we've been spending a lot of time thinking about that as a practice, and just thinking about what our society is going to be doing over the next 3 months or so. A huge benefit to the way that Kentucky has handled this is that far fewer people are going to suffer and die from this disease, but it can spread out the duration of how long we have to do social distancing. And certainly the end of April is clear. Whether or not it'll extend to the end of May as well or beyond, I think is unknown. It just really depends on how quickly this can work itself out. One thing we realize is there's a lot of people. This is not just true in retina and ophthalmology, but throughout the healthcare, who we're seeing doctors who have problems and issues with their health that still need to be taken care of, and a lot of those are not being taken care of now. So we are concerned that there may be some people who have suffered from non-COVID diseases during this time, whether it's their heart disease or their kidney disease or their diabetes, that are then going to come, and it's going to be a real rush on the health system, sometime this summer. And there may even be capacity issues at that time. At the same time, we're not going to be able to see patients in the same way. I think it's not going to be like flipping a switch where all of a sudden we go back to the way things were. So navigating through the water of how we take care of people in the post-COVID world is going to be challenging. And I know, John, you've been talking to some other national leaders and some other retina practices, and we continue those conversations to kind of come together with best practices and ways to take care of patients, take care of staff, take care of the health of Kentucky in our practice by using these best practices.
Absolutely, Tom. I echo those sentiments, and we will have the manpower to be able to do it, whether it involves us staying, longer and later or working on weekends. We'll make it happen. Tom, I want to wish you a happy Easter, and I know I'll see you at some point. I hope it's sooner rather than later, and I hope it's not via video chat going forward.
Thanks so much. Thanks so much for the interview, John.